My name is Simon Sandler, and I'm a consultant neurosurgeon and spinal surgeon at the Royal Adelaide Hospital. I'm head of unit of neurosurgery here, and then I also work across the orthopedics and trauma unit on the spinal unit. So I have two positions. I also am a visiting medical officer at St Andrew's Hospital and the Memorial Hospital, where I also operate privately and have rooms on Melbourne Street as well, called Adelaide Spine and Brain.
So, what first sparked your interest in medicine?
That's a very difficult question to answer. My dad's a doctor. My dad's an obstetrician and gynecologist. So, from a young age, I grew up in a family with a medical doctor. My mom was a scrub nurse. In fact, she actually was on the team working with the first heart transplant with Christian Barnard. So there was a lot of medical things happening in my family, and that probably tweaked my interest initially. That growing up also watching programs like ER on TV. But yeah, I enjoyed the sciences at school. I think I was less language inclined and more scientific and mathematic in my basis, and I really enjoyed biology as well, and chatted to my dad a lot about careers when I had to sort of select them, and medicine was one that I think just sort of came to me, and applied for it and got in, and so I was quite happy with that choice, and I think it suited my personality quite well at that point in time, and that was when I was living back in South Africa in Cape Town.
Okay, and then what made you decide to actually go into the specialty of neurosurgery as a career?
Yeah, it's also a very interesting question. I found during my clinical years that I really loved being in theatre. So things that appealed to me at that point in time were anesthetics or any actually surgical speciality. I just enjoyed using my hands. And then after I finished my internship, worked on a neurosurgical unit. And in South Africa, from a sort of young age, as a young doctor, you get to be exposed to quite a lot of cases, and you get to do a lot of things as well. So I got my hands dirty, so to speak, very early on, and I just really loved the team I was working with. And I think that's what swayed me firstly, was I fell in love with the people I was working with. And then I started to also get really interested in the discipline itself. Initially, I was actually more taken by spinal surgery, and these days neurosurgeons and also orthopedic spinal surgeons share the spine. But after I finished working in that unit, I went to the UK, and I worked at Guy's and St Thomas's Hospital there in a spinal unit, and completely just fell in love with spinal surgery. But then got offered a job back home in neurosurgery and took it up, and during my registrar times fell in love with the brain as well. So now I operate on both of them. But I think that's where my interest initially lied, was that I enjoyed operating. I enjoyed being in theatre, and I enjoyed that side of things. Yeah. And then fell in love with neurosurgery.
And so how many years did it take you to train as a neurosurgeon?
Well, medicine in South Africa is 6 years, and then you do a year of internship and a compulsory year of community service. And then you've got to work to get onto a program, just the same as it is here, and it's quite competitive. So doing research, buffing up your CV, and then you have to, in South Africa, before you can be eligible to get onto a neurosurgical training program, you have to write 2 exams. One is a primary exam, including neuroanatomy, and the second one is a more generalist exam, but it includes all the surgical disciplines, and you have to have done at least 18 months of general surgery to be eligible to write that exam, and some ICU time. So that took me about another 3 years to be eligible for selection onto the program. And then I got offered a registrar position, and that is a 5-year registrar training program.
Wow, so it's quite a,
Yeah, and then I came to South Africa. Yeah. I came to Australia to further subspecialize, and then also wrote the Australian exam as well. So that was also a bit of time as well.
And did you have any standout teachers or mentors along the way?
Certainly. I mean, a lot of people in my unit back home have stood out to me. They may just be names, but I will mention them. One was Graham Fegan and Jonathan Peter. Jonathan Peter's now subsequently passed away, but he was the ex-head of unit, and Graham Fegan is now the current head of unit. And then I also worked quite closely with 2 other neurosurgeons, David Walsh and Patrick Semple. And then I did a sub-specialization before I came to Australia in spine again with Rob Dunn. And then here in Australia, I've worked with a number of great neurosurgeons. I spent time in the spinal unit initially working with Brian Freeman. And then down at Flinders, I've worked with Nick Rodos and Matthew McDonald, and back here at the Royal with Steve Santrinios.
Okay, so what actually brought you to Australia?
Yeah, initially it was to do a further subspecialization after I finished my neurosurgical training program, and there was a chapter which is worldwide called AO Spine, and one of the main centres in Australia was in Adelaide. So I applied through that fellowship program and got selected for the fellowship here.
Okay, so that sort of leads us also, and you have already mentioned, but could you just list them again, your subspecialties and your areas of interest?
Well, I mean, I'm interested in cranial neurosurgery, but more general things there, including, trauma, infections, hydrocephalus, and unfortunately brain tumours. And then my sort of really niche subspecialty would be spinal surgery and sort of all aspects of that.
Mm-hmm. And can you give us an example of a day in your life as a neurosurgeon?
Oh, all right. Well, I mean, a day like today, for instance, started extremely early, probably at about 3 o'clock in the morning with my little boy needing a nappy change. And then it was definitely, the whole family was up at about 6 o'clock in the morning getting breakfast ready and getting everybody ready for school because I've got 3 small kids, 6 and under. And then I did the school drop-off for my son and then rushed across to do an operation. Unfortunately, a spinal tumor that needed to be taken out, and the spinal cord decompressed and the spine instrumented and fixed and stabilized. And then I've rushed across to the RA to do some administrative work and answer some emails and meetings. And now I'm down in the outpatient clinic at the Royal Adelaide Hospital about to run my clinic.
Okay, and I think you said earlier you're covering for some trainees who have COVID.
One of our trainees at the moment has COVID, so we are, this is a man down at the moment. So trying to just get stuck into the clinic as early as possible so we can all finish at a decent time.
What are the most hours you've ever worked in 1 week?
In 1 week? Let me see. Maybe 100 hours.
And what's the longest you've ever gone without sleep?
Definitely close to 36 hours.
What was your first surgery on a real patient?
It was my first ever surgery was as an intern, and that was putting in it was a medical student putting in a chest drain. Probably first surgery in theatre was excising a lipoma. First neurosurgical case as a registrar was putting in an external ventricular drain for a patient with hydrocephalus.
What was the longest surgery you've ever performed?
I think one of the longest surgeries are sort of very complex spinal deformity surgeries where you have to put in huge amounts of screws, expose huge amounts of the spine, and also sometimes reconstruct that spine. So those are sort of sometimes upwards of 6 to 7 hours. Yeah.
What's the most number of surgeries you've performed in one day?
As a registrar in South Africa, trauma craniotomy after trauma craniotomy, unfortunately, so probably about 7 in one day. Yeah.
And what's the most common surgery that you perform?
For me, I would say the most common operation in my practice at the moment would be either a cervical decompression, a cervical fusion, or total disc replacement, or a lumbar laminectomy or discectomy for sciatica.
And what's you already touched on this, what's the most complex surgery you've ever performed?
Again, I'm biased towards the spine, so I think some of the sort of reconstructive spinal procedures are extremely complex. They take into a lot of planning, a lot of instrumentation, a lot of equipment in theatre, and very challenging cases sometimes, yeah.
Okay, so which do you prefer, coffee or tea?
Definitely coffee.
Savoury or sweet?
That's a challenging one. I think I would favour probably just a touch more savoury.
And what sport do you follow?
I follow all sorts of sport, but my favourite probably to watch is rugby. I mean, I support the South African team and I support the Australian team. But when they play South Africa, that's a challenge.
What is one standout memory of your career?
Well, I mean, I think the day I graduated as a neurosurgeon is just a pinnacle and culmination of everything. You know, I actually had an exam not in Cape Town where I lived, but I was up in Durban, which was my fellowship exam there, and it was stressful. I had to travel there. You know, you have to find accommodation. You're in an unfamiliar hospital where you have to find your way to the examination room, and it's sort of everything you've worked for your whole life. And you find out that afternoon, you do the written paper first, and then you get invited to the orals, and you find out that afternoon that it's whether you passed or failed. They just put your name up on a board. But luckily enough, my dad was kind enough to travel with me, and he's also a big mentor for me. And we celebrated together. And so that was a massive milestone for me. And I think, every day I have standouts in my career whereby I have sort of successes with patients and really good outcomes and positive outcomes, and I've managed to really make an impact in somebody's life. That's a standout for me as well. I think also passing the fellowship exam in Australia, it was necessary to be able to progress forward in this country, which is my new home. So was obviously very happy to sit that exam and was very pleased to pass it.
Thank you. It's very interesting, yeah. What are some of the biggest challenges?
Look, I mean, I think being head of unit in this hospital, we have challenges on a daily basis with just bed shortages, bed crises, and COVID's been a massive challenge for us as well. You know, we're still trying to manage wait lists. We've got patients that have very urgent operations, and we've also got ICUs that are completely full with intensivists and anaesthetists that are very tired. So, juggling beds, juggling a workforce on a daily basis is very challenging. But certainly, I mean, I look at every single surgical case as a challenge. Sure, there are cases that are extremely enjoyable, and there's cases that are highly stressful that keep you up all night thinking about them. But meeting those challenges, not shying away from them, and coming out at the other end, I think brings me joy. But yeah, every case is a challenge in its own right. Yeah.
And what advice would you give to a student interested in pursuing neurosurgery?
I would say if you're a student and you already know what you want to do, great. But I think there's so much that is out there within medicine and surgery. I wouldn't sort of want a student to sort of push themselves into a corner too early. I'd say have a look at everything, make up your mind. Neurosurgery may appear attractive from the outside, but spend time, get in there, do the long hours, the late nights, not seeing your family, the highs and lows. I would say to a student, rather don't feel rushed or pressured to jump onto a discipline. See what's out there and make up your own mind after you've really looked at it all. Yeah.
That's good advice, thank you. Do you do much research? What's your interest in neurosurgical research?
Well, I did do a lot of research back in South Africa. In Australia, I've been involved more in research on the spinal side. So, there's a lot of spinal projects that we have underway. And I'm also more interested in traumatic brain injury, where I've done a lot of research in South Africa, especially in a pediatric population. So that would be my major area of interest in adults. It would be traumatic brain injury.
Okay. August is Neurosurgery Awareness Month. Are there any aspects around neurosurgery that you wish there was more awareness around?
Well, I think, we still unfortunately see a huge amount of motor vehicle accidents, a huge amount of traumatic injuries, falls from heights. We have a ever-aging population that, people want to still remain independent. I get it. But being up a ladder when you are 80 years old is potentially asking for trouble. I wish there was sort of still more awareness around road traffic accidents and traumatic injuries of the brain and spine. And along with that comes, unfortunately, the incidence association with alcohol. So I think there was probably more awareness around alcohol and drugs that might sort of help us lower the impact of burden with those two major areas. And yes, I mean, unfortunately, we still see huge amounts of brain tumours, both in the pediatric and adult population. So I think, awareness around those issues would also help with, fostering more research and maybe even more donations for research.
Thank you. And what do you enjoy doing outside of work in your spare time? What's your passion? I do have lots of passions. I just don't have a lot of time to spend on them. I've got a very young family at the moment, so outside of work, that's my passion, is spending time with my family. Weekends are spent at ballet and swimming and violin lessons. Just watching my young family grow up is a passion of mine, really. If I had to choose a sort of hobby that I've taken up during COVID, that was running, actually. And I've quite enjoyed seeing my fitness improve over the last 2 years and lose a bit of weight and just feel a bit better about myself. So when I do have a bit of a spare moment, I'd like to get out and run a bit and try and get faster and run a bit further.